Hi everyone, this is Kate from Motivate Therapy again, this time talking to you about prolapse. So some of you may have heard of this before, maybe from a doctor or for a friend, or maybe you've heard about it for yourself in your own research, but pelvic organ prolapse is a diagnosis that covers a wide variety of things, but is specifically related to the pelvic organs, the rectum, the uterus, and the bladder, all beginning to droop a little bit. They start to fall down in the lower pelvic floor, putting a lot of stress on those pelvic floor muscles. So the symptoms of this vary from person to person. Sometimes they look like you're dealing with fecal incontinence, urinary incontinence. Sometimes it presents as low back pain. Sometimes it presents as a feeling of fullness vaginally. Sometimes it just is that chronic pain in the tailbone. All these things, as well as a number of others, are affected by pelvic organ prolapse. And so prolapse, as we commonly refer to it, is affected by a couple of other things then too. So typically when you come in for pelvic floor therapy, we're looking to see if your doctor has given you that diagnosis. Therapists are not allowed to diagnose this specifically, but we are trained to recognize the symptoms of it. And there is a wide body of research actually out there about this. So a lot of things in physical or occupational therapy, we're working to build up the body of research. We know that it works because of this long history of people working with their therapists and seeing these results, but now we're even having statistical data to back up that what we're doing really helps with that. Even if you've already had surgery, or maybe you're thinking about having surgery, if you're wondering whether or not it'd be worth it to come in, the best thing to do is talk to a pelvic floor therapist, whether talk to one of us or someone you know or anything like that. So the big thing with the treatment for pelvic floor therapy when you're dealing with prolapse is that we're trying to address what caused that to begin with. So prolapse occurs when there's more pressure happening from above. So if there's a lot of pressure pushing down on your pelvic organs, that will create that pressure feeling. It starts to fall out a little bit. And then that puts more pressure on those tiny little pelvic floor muscles that they just can't hold it up. So our treatment focuses on how do we decrease the pressure that's happening from above and how do we increase the strength that happens from below. So we decrease that pressure typically by working with people on things like posture, abdominal massage, stretching through the front of our hips if you have a sedentary job, or, I see a lot of, mothers coming in, they're doing a lot of lifting, pushing, whether it's for housework or for just purely caring for their children. We try to help you, teach you ergonomic ways to do that doesn't put as much pressure on your pelvic floor. And additionally, we also try to teach you ways to strengthen your pelvic floor. So for some people that involves a relaxation component. You can't strengthen a muscle that's too tight, and we could talk about that in a later video. But we could also work on strengthening the muscles that help your pelvic floor to do their job, such as your lower abdominal muscles, your hip muscles, your back muscles. All those things support the job that the pelvic floor has to do. And additionally, we also talk about what role maybe some hydration might be having in this. Maybe proper nutrition might actually change some of this for you if you're really dealing with some wild fluctuations, because the body is a whole system. And so if you're having issues in an area that's not a part of a therapist's expertise, we try to help refer you to people that might be able to help you with those aspects of why you're experiencing those symptoms. So to sum up, pelvic organ prolapse is really common. It affects over 3 million people all over the world. I think they say over half of women over the age of 60 are dealing with this. So it's something to really consider whether or not it's an issue that you might have or contribute to some of your symptoms. And then secondly, pelvic floor therapy really helps. So schedule your free consult, or talk to your friend, or talk to your doctor, or see what you can do to talk to somebody about how you can change your symptoms today. Thanks.